As defined by the National Athletic Trainers Association, athletic training encompasses the prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute, or chronic injuries and medical conditions. Athletic training is recognized by the American Medical Association, Health Resources Services Administration, and the Department of Health and Human Services as an allied healthcare profession. An athletic trainer is a highly qualified, multi-skilled healthcare professional that collaborates with physicians to provide preventative services, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation of injuries and other medical conditions. Athletic trainers work under the direction of the physician as prescribed by state licensure statutes. It has always been assumed that athletic trainers work solely with athletes, but that is not the case. Athletic trainers work in a variety of settings such as public and private secondary schools, colleges and universities, professional and Olympic sports, physicians' offices, hospitals and clinics, occupational and industrial settings, governmental departments, and the military. Companies such as the FBI, NASA, and Boeing have elected to employ athletic trainers to provide sports medicine services to all of their employees. In the state of Alabama, Auburn University provides incredible services to our military. Utilizing a $3.2 million grant, the Warrior Athletic Training Program provides prevention, diagnostic services, treatment, and rehabilitation of injury services to any Auburn military personnel. The program provides sports medicine services to over 3,000 initial entry training soldiers at Fort Benning.
Hi, I'm R.T. Floyd, Director of Athletic Training and Sports Medicine at the University of West Alabama. Athletic trainers, of course, today can be found in many settings, and the role of that athletic trainer starts from the very beginning of care, that is prevention of athletic injuries and prevention of the inappropriate movements and so forth in the workplace or on the field or on the court, an immediate recognition of those injuries when they do occur, which may involve first aid or advanced life support in some cases, to continued treatment and rehabilitation, both in the immediate phase as well as the several days and weeks beyond that injury, and even post-surgical.
So the role as an athletic trainer in an industrial setting is usually our main goal is to reduce the workers' comp in the area. So we try to treat our patients on site if at all possible, so they lose a minimal amount of work. We usually have physical therapy clinics on site. We'll treat them there and just hope that we can improve their discomfort to get them back out working as opposed to them losing multiple weeks of work at a time. The requirements needed to be employed as an athletic trainer in an industrial setting are very similar to anywhere else. Obviously a bachelor's degree at a KD accredited college, and also to pass your board certification and be a licensed athletic trainer. Another thing that they do, and most places do, is a big background check on you. So you are in an industrial plant, so it is safety regulations to make sure you have a healthy background check. So a typical day in an industrial setting, usually start your day, it's usually shift work, so there's 3 different shifts. If you're on morning shift, your day usually starts about 6 a.m. And you'll get in there, you'll go in the clinic and get a schedule set up for when all the industrial athletes that are on site get set up and what times they're coming in that day. You can go on the line and check on them and make sure that they're at work that day. And also, there's a lot of ergonomics involved in this job. So you'll go out on the line, we assess each employee's job that we're treating at that time and see if that job's hurting them or making them better. And we try to compensate for their injury in that case, either take them off that position or see what might be better or a better biomechanics way that they can do that job. There's no certifications required for that outside of regular athletic training certifications, but it is encouraged if you plan to stay in that field and want to go further in it to have an ergonomics certification. So that's something that you can take. It's not too many extra courses, and you get that certification, and it just encourages more for you to be closer related with the ergonomics and safety departments in that program.
Hey, I'm Candace Keene with Champion Sports Medicine and the University of West Alabama. I am a physical therapist and an athletic trainer. I love doing both. During the day, I get to see all of my patients in the clinic, and then different evenings, and especially during the fall, I get to be out there on the field with my athletes. It's the best of both worlds. I knew that I wanted to be a PT, and then athletic training fit perfectly in my mind with that. And so I get to see them post-surgery and then all the way during their recovery back out to the field, which is awesome. In order to get both my degrees, I have a bachelor's in athletic training, so that was a 4-year degree, which of course y'all know, and then the doctorate is another 3 years, so I have a doctorate in physical therapy and then a bachelor's in athletic training. Typical day for me, I start at 7:30 in the morning and then I treat patients all day, and especially during football season, guaranteed on Friday night I'm going to be on a football field, which is great. I love it.
Well, the athletic trainer at the secondary high school wears a lot of different hats. I personally wear one where I'm a teacher for the first part of the day. There I wear the hat between the coach and the parents, between the coaches and the doctors, between other athletic trainers. For high schools that don't have athletic trainers, sometimes I go and cover for them. So my typical day, I have the privilege of also teaching. So my high school is in block setting, so all the students take 4 classes a day. So I teach the 3rd block class. I get to school around 9:30, check with the office, check with the coaches, make sure there's no one I need to see immediately. Sometimes the school nurse has someone for me to go see. So I see them, make sure that I'm ready to lecture for the day. And so then I teach an 1.5-hour class. We're doing athletic training taping right now. So we'll be hands-on in the athletic training room for lab time. And then when that's over around noon, I start with just being the athletic trainer and wearing that hat for the rest of the day. Kids come in and out. I'll visit different practices, make sure everyone has what they need, and then I'll go to games, sit out at football practice. My day typically ends on a regular day around 5:30, but if it's a game day, sometimes I'll be there till 9:30, 10 o'clock.
Regardless of the setting, athletic trainers practice accordingly to their education, scope of practice, and State Practice Act. In order to become an athletic trainer, students must obtain an athletic training degree from an accredited athletic training education program. Currently, the minimum entry point into the profession is a bachelor's degree. However, recently the Athletic Training Strategic Alliance decided that the minimum professional degree level will be a master's degree. This change is to be implemented within the next several years. Professional athletic training education uses a competency-based approach in both the classroom and clinical settings. Using a medical-based education model, athletic training students are educated to provide comprehensive patient care in the 5 domains of clinical practice. These are prevention, clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, and organization and professional health and well-being. Upon completion of a CATIE accredited education program, students become eligible for national certification by successfully passing the Board of Certification examination.
With my education this far, I feel like I'm becoming more comfortable with lower body evaluation and injury and illness assessment. I chose athletic training because I was an athlete in high school, and then injuring it led me to realize such a big help athletic trainers really were, and the meaning and responsibility that they have. And it really fit me very well to know that I could actually be helping someone. I could use my story to help others come back. My aspirations in athletic training are to become the best athletic trainer I could be, to work my hardest to take care of others and help them come back from any type of injury.
So, with me being a junior, my responsibilities range a pretty wide, variety of things. It starts out with injury, illness prevention, and treatment, and that goes off to a lot of different things. So, we tape, wrap, and brace any injury that comes into the athletic training room. But I'd probably say my number one thing that I'd like to do is definitely the treatment plans. I'm a big proprietor of getting them back as soon as possible, as quick as possible, keeping them interested.
As a senior right now, my education has prepared me in the clinic and in the classroom for taking my BOC certification exam. It also has given me an opportunity to learn how to evaluate, rehab, and treat many injuries and illnesses in athletic training. I chose athletic training because I enjoy being around athletes and helping them medically get back to where they were before they had an injury. My typical day as an athletic training student starts with coming into the clinic to work with private patients and goes to class afterwards, and then around 12 o'clock you get lunch. You start your rotation about 1, you have practice till about 5:30 or 6, you go home, you do homework, and you go to sleep about 9:30.
I began my undergrad at a college that did not have a athletic training undergraduate program, so I was able to get a job being a student athletic trainer in their sports medicine area and continue to fall in love with athletic training. I, after graduation, was accepted into a master's program, which is a 2-year degree, and I got my master's in athletic training. When you get to the master's level, people know what they want to do, they have the passion for it, they're working harder. It is only 2 years, so the curriculum is combined and it's a lot at one time. We do more in the area of research. Everybody is required to do a research project. Clinical hours, it seems that you do a lot more in a short amount of time, trying to get a lot of variety between high schools, gen med, ER.
Of course, in all these settings, whether it be an industrial setting or in performing arts, or certainly in an athletic setting, athletic trainers can make a huge impact on the time loss. Many of the things that we do are not necessarily time loss injuries, but injuries that need to be managed on a daily setting. That is, athletes who have ankle sprains and strains who can still participate, but need care to do that as safely as possible. And we've definitely seen the reduction of time loss injuries and all by having that immediate care and appropriate rehab beginning as soon as possible, whether it be in a work setting or whether it be in an athletic setting. So athletic trainers can make a huge difference.
Athletic training is an ever-growing, internationally recognized healthcare profession. The knowledge and skills provided to students allow schools and companies to feel comfortable in their employment of athletic trainers. Athletic trainers have the ability to prevent, diagnose, and treat any injury or illness to any patient.